Science. So today we are going to talk about mixed venous oxygen saturation. The definition of mixed venous oxygen saturation is it tells how much oxygen is utilized by the peripheral tissues by assessing the oxygen saturation in the right atrium. In order to understand this, we have to understand what is meant by oxygen saturation. So here we will draw a small diagram of the red blood cell. So this is the red blood cell, and each red blood cell is going to have up to 4 hemoglobin chains. Each RBC is going to have 4 hemoglobin chains, and each hemoglobin chain can hold one oxygen molecule. So a total of 4 hemoglobin chain can hold up to 4 oxygen molecules. So in summary, we can say that whenever the 4 oxygen molecules are sitting on the 4 hemoglobin chains, we say there is 100% oxygen saturation. I hope you are clear with this term. Next we will talk about mixed venous oxygen saturation. So in mixed venous oxygen saturation, we are going to place a machine in the right atrium. This machine is called as your Swan-Ganz catheter, and this machine will assess the oxygen saturation at the right atrium. Okay, so first we will see what is happening in a normal person. In a normal person, the aorta is going to carry 100% oxygenated blood. Out of this 100% oxygenated blood, nearly in the peripheral tissues, these are the peripheral tissues, there is utilization of nearly 30% of oxygen. Okay, and after that the blood will travel into the vena cava, and finally through the vena cava it will enter into the right atrium. So in the right atrium, I already told you, we place the machine called as your Swan-Ganz catheter. So we will do the math here. So 100% oxygen was there in the aorta, out of which 30% was utilized by the peripheral tissues. So in the right atrium, there should be nearly 70% oxygen saturation in the right atrium. This is the percentage that is in normal human beings. Okay, now we are going to understand what is going to happen in septic shock or neurogenic shock. So in septic shock, once again we are going to place the Swan-Ganz catheter at the right atrium, and we will assess the oxygen saturation. So in the aorta there was 100% oxygen saturation, and eventually this blood will go to the peripheral tissues, right? So in the peripheral tissues, normally 30% of the oxygen should be utilized, right? But in septic shock or neurogenic shock, what happens is, in septic shock there is bacteria present on this tissue. Whenever there is bacteria present on the tissue, this bacteria will not allow, let's clear this one, there is no gaseous exchange. It means there is no exchange of oxygen at the peripheral tissues. Hence we say there is decreased oxygen utilization at the peripheral tissues. Instead of 30%, we will take a lesser amount, which is 10%. In the peripheral tissues, only 10% oxygen is getting utilized. And finally, through the vena cava, the blood will return to the right atrium. So how much saturation will be at the right atrium? There was 100% oxygen at the aorta, right? Out of 100%, only 10% was utilized. So 90% will be the mixed venous oxygen saturation. What was the normal? Normal was 70%, but here it is increased to 90%. So So in septic shock or neurogenic shock, there is increased in mixed venous oxygen saturation, because in the peripheral tissues there is decreased utilization of oxygen. Okay, 90% is increased mixed venous oxygen saturation. Okay, I hope you are clear with this. Next we will talk what is going to happen in cardiogenic shock or your hypovolemic shock. So in hypovolemic shock, as the name suggests, there is hypovolemia, means there is decreased volume of blood. Whenever there is decreased blood, there is decreased hemoglobin. If there is decreased hemoglobin, obviously the oxygen saturation will also decrease. It means in the aorta should contain 100% oxygen saturation, right? But unfortunately, due to decreased blood, imagine there was 6 liters initially. Due to blood loss, this person is having only 3 liters. If there is 3 liters or decreased blood, it is going to have decreased hemoglobin, due to which there is decreased oxygen saturation, right? So instead of 100%, this guy is having only 80% oxygen saturation in the aorta. And how much oxygen is utilized by the peripheral tissues in a person? In a person, the peripheral tissues use nearly 30% oxygen, right? And finally, via the vena cava, the blood is going to return into the right atrium. In the right atrium, the Swan-Ganz catheter will assess the oxygen saturation. So we will do the math here. So due to decreased blood, there was only 80% oxygen saturation in the aorta, and 30% was utilized in the peripheral tissues. So in the right atrium, the oxygen saturation will be 50%. And what is the normal oxygen saturation that is in the right atrium? It should be 70%, right? So we can say there is decreased in mixed venous oxygen saturation. So in in hypovolemic shock or cardiogenic shock, there is decrease in mixed venous oxygen saturation. Okay, so in summary, cardiogenic shock or hypovolemic shock will have decrease in mixed venous oxygen saturation, whereas in the case of septic shock or neurogenic shock, there is increased in mixed venous oxygen saturation. So that was about it, guys. Thank you.